that.
You are muted,
I'm
Patricia, and I'm sharing your slides now.
Okay, thank you so much. So for those of you who don't know me, my perspective here is from the research side, mainly from the European Programme for Research and Innovation, Horizon 2020. I think that everybody here in the audience is well aware of the challenges of the European health systems so far, including the aging population, comorbidities, inequalities in the access to healthcare service, and so on. And it's pretty much clear that digital applications and health data have an enormous potential to improve the health of citizens. So we can move to the following slide, Paulo, please.
Sure.
Thank you. What I want to share today is that data-driven healthcare will surely lead to better prevention strategies, will allow the development of targeted therapies, new diagnostics, and strongly contribute to the implementation of personalized medicine, and ultimately to new health and care models. So there are a lot of technologies that can be used to achieve these goals, and we need to invest on research and innovation, and also to promote the implementation of these new tools in the health system. Can we move to the next slide, please?
Sure.
Thank you so much. So I want to share with you that recognizing this need, the European Commission adopted in 2018 a communication on digital transformation of health and care in the digital single market. So the goal is to boost the EU action on this front. This communication consists of 3 priorities, and for each of them, the EU is implementing specific actions in order to achieve the proposed ambitions. So the first priority is secure access and exchange of health data. The goal is that European citizens securely access their health data, and health providers also can exchange, doctors or pharmacies can exchange health data across the EU. The second priority is that health data can be pooled for research and personalized medicine. We want to see shared health resources, data, infrastructure, expertise to allow targeted and faster research, diagnostics and treatments. And the third priority, it's digital tools and data for citizen empowerment and person-centered healthcare. So we want citizens to be able to monitor their health, to adapt their lifestyles, and to interact remotely with their doctors and carers. So the EU is taking action in all of these fronts. We can move to the next slide. And one, not only, but there are many actions in place, and SPMS has been a part of much of this work. But part of what the European Union is doing, it's promoting research on this field by opening calls for funding through the European Research and Innovation Framework Programme, Horizon 2020. So we fund many areas related to health data and digital health transformation. And coming a bit back to what was discussed before about open innovation and partnership models, everything we do in Horizon 2020, it's done in a multidisciplinary and cross-sectoral way, including at least 3 different countries. So very good examples of calls that are collaborative and work that is done in partnership. So I have here just a few examples of calls that are currently open, but will be closed soon. Deadline is in June. But many projects are already up and running in this field. Can we move to the next slide, please? Thank you. So this is just a couple of examples of projects and initiatives that have been promoted by the EU with a focus on health data research and on medical applications. All of them include participants from Portugal. We have many others, and again, SPMS strongly participates in the European research program. I'll give you an example here of iPrognosis, the first one, where they propose a radical approach to capture the risk of transition from healthy status to Parkinson's disease, based on the collection of behavioral data acquired by the interaction of the users with their smart devices, smartwatch, mobile phone. It's a €4 million project with 6 countries, with 2 Portuguese participants. I would also like you to take a look later, because the slides will be shared, at the Eden project. This project is funded by the Innovative Medicine Initiatives, and their goal is to map 100 million health records across the EU via a common data model, with the goal of reducing the time to provide an answer in real-world health research. So they are developing an infrastructure in a federated network across Europe and collaborating on research methodologies. It's a €5 million project, and Portugal is also involved. My third example, it's the Smart Health project. This project is actually coordinated by Portugal, by Uninova. It's a €22 million project that's based on the vision that every citizen of the European Union should be able to access her or his own health data easily and securely within each member state. So they are developing an application for this. And finally, I would like to highlight, this is not a project, it's an European Union initiative. It's the 1 Million Genomes Initiative. This was launched also on 2018 on the Digital Day, and currently involves 21 member states plus Norway. These countries meet on a regular basis in order to make sure that the aim of the declaration, which is having at least 1 million sequenced genomes available in the EU by 2022, is achieved. You will have tomorrow Astrid Vicente in one of the panels, and she's coordinating this from the Portuguese side. And my last slide, to be able to finish by 4:30, is to let you know that other funding programs will be launched in 2021. So there are many opportunities ahead. So I'm looking forward for your comments and questions. And Paulo, thank you again for the invitation.
Thank you so much, Patricia, for the efficiency and